Welcome back to MedBytes with DocAJ, the place where we decode your medical journey, one bite at a time. Today, I'm diving into a topic that every MBBS student needs to hear, the top 5 mistakes medical students make, and more importantly, how to avoid them. These are mistakes I've seen others make. I've made some myself, and I know many of you might be on the verge of making too. So let's break them down and help you navigate your MBBS years with confidence and clarity. Let's start with mistake number 5, ignoring clinical skills during the early years. During first and second year, it's all about anatomy, biochemistry, and endless theory. Most of us assume we'll figure out the clinical stuff later. But when third year or internship hits, that's when reality slaps you. You're in front of a patient, and you don't know how to take vitals, auscultate, or even speak confidently. The key here is, don't wait for clinics to get serious. Start early, observe seniors, ask questions, volunteer to take blood pressure, or just spend extra time in the wards. You'll be amazed how much confidence you can build simply by showing up and trying, even if you make a few awkward mistakes. Mistake number 4, following the herd blindly. This one's so common, especially during PG counseling or branch selection. Your friend wants to do radiology, so you feel maybe you should too. Someone says general medicine is boring, so you start doubting your interests. The problem is, if you follow someone else's dream, you'll never find your own. It's okay to explore, but make your own decisions. If you enjoy medicine, explore it if surgery excites you. Scrub in if you're curious about psychiatry. Talk to a psychiatrist. Don't let peer pressure guide your career path. Trust your instincts and experiences. Mistake number 3, cramming just before exams. We've all done it, the all-nighters. Coffee-fueled revision, last-minute panic. It's part of the med school culture. Right, but here's the truth. Medicine is a marathon, not a sprint. You can't rely on shortcuts forever. Develop a daily study habit. Even 2 focused hours a day can change your life. Revise weekly, solve MCQs, make your own notes. Not for the exam, but for long-term retention. Because believe me, PG preparation doesn't start after final year. It starts now. Now mistake number 2, and this one's serious, ignoring your mental health. MBBS can be overwhelming. The pressure, competition, expectations from family, the fear of failure, it all adds up. If you feel anxious, demotivated, or constantly stressed, you are not alone. Please reach out, talk to a friend, a mentor, or a counselor. Don't wait till you burn out. And if you see a batchmate struggling, be kind. Sometimes one message or a small conversation can make a world of difference. Remember, your mind is your most valuable tool. Protect it. Finally, mistake number 1, treating internship like a break year. I get it, final year drains you, but internship isn't a vacation. It's your transition from student to doctor. This is where you actually learn to handle patients, write case sheets, take decisions, and work with a team. It's also the best time to truly discover which specialty you want to pursue. Yes, the hours are long, but the experience is priceless. And if you're preparing for PG entrance, use your time smartly. Create a study plan that fits your duty schedule. Because wasting internship is like skipping the most important chapter in a book you've spent 4 years reading. Now a few bonus tips just for my MedBytes fam. Keep your logbook updated. Participate in case discussions, even if you feel like you don't know much. That's how you learn, ask questions. Be curious, and above all, enjoy the process. Medicine is a privilege. You are becoming the person someone will trust with their life. That's powerful, that's sacred. Don't let stress or comparisons rob you of that joy. Before we wrap up completely, I want to leave you with something that's not talked about enough: building meaningful connections during MBBS. One of the most underrated aspects of your journey is the people you meet. Your batchmates, seniors, professors, and even nurses, all of them become part of your learning ecosystem. So don't just be that library to hostel kind of student. Engage, interact, help, ask for help. Because when you're stuck during internship, it's not the textbook that'll bail you out, it's your network. Also, learn the art of communication. As doctors, we often focus only on diagnosis and treatment, but the way you talk to a patient, break bad news, or comfort a worried family member, that's what truly makes you a healer. These are soft skills, yes, but they're powerful. Watch your seniors, learn from mentors, ask for feedback, and keep evolving. And finally, don't forget why you chose this path in the first place. If this video helped you or made you reflect on your journey, go ahead and give it a thumbs up. Share it with your med school gang. And don't forget to subscribe to MedBytes with DocAJ for more real, honest content about life in medicine. And let me know in the comments, Which of these mistakes do you relate to the most? Or what's something you wish you did differently during your MBBS? Until next time, stay grounded, stay growing, and as always, stay true to your white coat.